For decades in the United States, we've been told that universal healthcare is an unreachable dream.
I want America to have the finest healthcare in the world.
The healthcare bill, just
And I want
insurance system.
Imagine waking up in a country where your healthcare is not tied to your paycheck. None of that in-network or out-of-network nonsense. No choosing between a life-saving surgery or a mortgage payment. We need only look to our southern neighbor to find an example of a country doing what we've been told for so long is impossible. Mexican President Claudia Sheinbaum just signed something radical, the Universal Health Service. Is Mexico really going to outpace the United States in healthcare accessibility? Well, let's look at the facts. To understand where Mexico is going, you have to understand where they were. For years, they had a very siloed healthcare system. If you were working in the private sector, you would go to the IMSS. If you were a public worker, you would go to El ISSSTE. And if you're unemployed, well, you're left to a patchwork of what were often underfunded clinics. Basically, the system was a labyrinth without end. You could be standing right in front of the hospital, need care, but if it wasn't your institution, you could be denied care. Sound familiar? The system had a similar logic as the US insurance market, where your care was a benefit of your employment and not your right as a citizen or resident. Enter the Sheinbaum plan. As of April 2026, the Mexican government has officially launched a universal healthcare plan. By 2027, the goal is complete interoperability, basically connecting historically fragmented institutions so that any Mexican citizen anywhere in Mexico can go to any hospital for any reason. The plan includes a universal healthcare card, basically one ID for everything. Digital records as well, a QR code with your medical history that follows you so that a doctor in, let's say, Tijuana knows exactly what was prescribed to you by a totally different doctor in Mexico City. Farmacias del Bienestar, a massive rollout of public pharmacy modules to ensure that free meds aren't just a promise, but a reality. In Mexico, they aren't asking, what insurance do you have? They're asking, where do you live and how can we help? That's the difference between healthcare as a commodity and healthcare as a human right. Now let's talk about the elephant in the room. Healthcare as it exists right now in the United States. The average American spends about $16,000 on healthcare every year. The average Mexican, $1,600, or about 10%. Obviously, economic realities are very complex, but the raw totals do not lie. On paper, the United States should have the best healthcare accessibility on Earth, but we don't. In the US, for example, we have massive cost barriers. A $5,000 deductible is a pretty big incentive to not go get the care that you need. In Mexico, on the other hand, the cost that you pay when you go get the service that you need is zero. The trade-off? In the United States, you might pay for speed to get the healthcare that you need right now, if you can afford it. In Mexico, you might have to wait a little while, especially when it comes to special medical services. But here's the kicker. Mexican private healthcare is still 50 to 70% cheaper than American private healthcare. Mexico is building a social safety net to ensure that nobody falls through the cracks. Meanwhile, in the United States, people are still arguing over pre-existing conditions and the cost of fucking insulin. But it's not all sunshine and tacos. Mexico still faces massive hurdles in public healthcare, with fewer doctors per capita than most countries and only 3% of its GDP devoted to public healthcare compared to 11% for more developed countries. Is a digital ID somehow going to fix a massive shortage of doctors? Well, not overnight. But the structure is changing. Mexico is truly building something for the 21st century. Meanwhile, in the United States, they're trying to fix a patchy system of public and private insurance policies that's long been outdated and dysfunctional. Whether Sheinbaum's plan fails or succeeds is yet to be seen. But one thing is clear, Mexico is making a choice. They're choosing to treat healthcare as a constitutional right and not a commodity. While Americans keep asking themselves if a doctor is in or out of network, or wondering if this emergency justifies a visit to the emergency room, Mexicans can go to any hospital so long as they have their new universal healthcare card. The question here really isn't about hospitals or medicine or emergencies or healthcare at all. It's more about what kind of a society do we really want to live in? What do you think? Would you trade the US model for Mexico's? Let us know in the comments, and be sure to follow Seguro Social Adelante for more.